ready? Okay.
The broadcast is now starting. All attendees are in listen-only mode.
We're going to get started with this section of Chronic Disease Prevention and Health Promotion webinar. I'd like to welcome all of you today to the webinar. My name is Ann Potempa, and I focus on public health education and communication for the Alaska Department of Health and Social Services. For the past 4 years, I have overseen a social marketing campaign called Play Every Day. The goal was to start by raising awareness about the health concerns linked with childhood obesity in Alaska and to motivate families to get closer to the recommended 60 minutes of daily physical activity needed by children for the best health. We have taken the campaign beyond promotion of physical activity. Last year, we added a new sub-campaign focused on motivating Alaska parents to serve their children fewer sugary drinks, knowing that sugary drinks are associated with obesity and related health problems. I'm going to focus primarily on the sugary drink campaign today. I'm going to take just a minute to explain how this webinar will work. You are hearing the audio for this webinar through your computer. Another option is to call 562-247-8321, and that number is on the slide in front of you. If you're having technical difficulties at any time during this talk, please let us know by typing in a question or comment using the question function on the GoToWebinar control panel. Some of you have microphones on your computer and you'll be able to ask me questions directly at the end of this webinar. You also can call into the phone number provided and ask a question at the end of the presentation. For those of you who don't have a microphone, you are more than welcome to type in your question online and we'll see them on our end. When the talk is over, raise your hand by clicking on the hand button. We'll either talk through the computer's audio or answer a question you type in. Either will work just fine. Now I'm going to return to the subject of this webinar. Childhood obesity is a significant problem in Alaska. In Alaska, about 1 out of 3 children are overweight or obese, and 2 out of 3 adults are overweight or obese. Obesity is costly both in terms of quality of life and in dollars. It puts children and adults at greater risk for chronic diseases, including type 2 diabetes, cardiovascular disease, high blood pressure, and high cholesterol. In Alaska, about $500 million is spent every year on the direct medical care costs related to obesity. The CDC has 6 target areas for obesity prevention. There's the increase of physical activity, fruit and vegetable consumption, and breastfeeding, and a decrease in sugary drink intake, junk food intake, and screen time. Play Every Day began focusing on physical activity and motivating Alaska children and their families to get closer to the recommended 60 minutes of daily physical activity for the best health. For the past 4 years, Play Every Day also has partnered with an Alaska nonprofit organization called Healthy Futures. Healthy Futures supports low-cost and no-cost family physical activities in many communities. It also runs a physical activity challenge in about 175 elementary schools across the state. These provide a free, fun, and easy way for thousands of Alaska kids to build the habit of daily physical activity. Play Every Day also focuses on reducing intake of sugary drinks. I will show you a number of our public education materials that we created to motivate Alaska families to drink fewer sugary drinks. I'll also talk about how we developed these and evaluated them. As a social marketing campaign, Play Every Day follows several key steps. Number 1, we target an audience with our messages. 2, all of our work is based on a foundation of research, including multiple focus groups done over several years, key informant interviews, and surveys for evaluation. We also go beyond raising awareness of childhood obesity as a problem. We started by motivating the audience to change knowledge, attitudes, intentions, and behaviors related to physical activity. And during the past year, we've expanded to motivate a change in the serving of sugary drinks to children. Our primary target audience has always been Alaska parents of children ages 5 to 12. That's elementary school age children. There are a number of key reasons for this. Children of this age still rely on their parents to determine how they spend their time. These children also rely on their parents to buy foods and drinks for the family. Young children are still building their healthy habits, and this is the age group of children who participates in the Healthy Futures Challenge. I mentioned earlier that social marketing campaigns like Play Every Day strive to go beyond raising awareness of a health problem, in our case, childhood obesity. We set goals related to increased knowledge and changes to behaviors. In terms of improved knowledge, we want to focus on that there's a large amount of sugar hidden in common drinks. Too much sugar leads to serious health problems, even among children, and added sugar is found on the ingredient list. We also want to focus on behavior changes, such as reducing the number of sugary drinks that parents serve to kids, increasing the likelihood that water and milk are the beverages served, and increasing the percentage of parents who check ingredient lists for added sugar. Next slide. Play Every Day has used, one slide back. Go back. Okay. Play Every Day has used focus groups and key informant interviews to learn about knowledge, attitudes, and behaviors related to being active and serving sugary drinks. We also use focus groups to inform the materials we create. We do this by sharing storyboards or concepts for TV public service announcements with Alaska parents to determine which are the most motivating in terms of increasing knowledge and changing behaviors. We also routinely use random digit dial telephone surveys of hundreds of Alaska parents to evaluate our work. We conducted a special survey design between June 2014 and April 2015 using a baseline survey and 3 follow-up surveys to measure recall of our public service announcements and any change in knowledge, attitudes, and behaviors. We've intentionally held multiple focus groups outside Anchorage and other communities to hear what parents have to say in many parts of Alaska. Here's the distribution of our first round of focus groups we conducted as we prepared for the sugary drink campaign development. We held groups in Barrow, Nome, Bethel, Fairbanks, and Anchorage. We asked families what types of sugary drinks they had in their cupboard shelves and learned that the most common household sugary drink was the powdered drink. That was followed by soda, juice drinks, and sports drinks. One of the most important reasons to hold focus groups is to hear what your target audience really thinks about a matter, because it may not be what you're expecting. We came into these focus groups representing the Obesity Prevention and Control Program, and we know that sugary drinks are linked with obesity. But when we asked parents to name their main concerns for children drinking too many sugary beverages, they named things like dental health, diabetes, and forming bad habits. Obesity and weight issues were mentioned more infrequently. That's important for us to hear, so we create messages and materials that address their concerns, but also educate the audience that obesity is a serious concern linked to drinking too many sugary beverages. We asked the focus group participants what factors influence their children's drinking options. Moms and dads was a big one. Parents admit that their children drink sugary beverages because they drink them too, and some parents felt bad about this. Other factors included other family members like grandparents who give treats to their grandchildren when they visit. Friends, TV, stores, and novelty products also came up. One thing we hear in urban communities is parents may stop at a gas station while driving their children on errands, and children will ask for a sugary drink from the convenience store. We conducted additional focus groups to test messages and storyboards with Alaska parents. Before filming PSAs, we create a storyboard that shows what the message will likely look and sound like. Storyboards accomplish this by pulling together about 6 photographs or cartoon images of scenes in the PSA and then include the spoken lines below. This gives our target audience a sense of the completed message, and these parents can tell us if this message is meaningful to them and motivating. This slide shows just one example of the first 2 images for a storyboard we tested and then actually filmed as one of our PSAs last year. Part of social marketing is focusing on the 4 Ps when creating messages to change behaviors. That is product, place, price, and promotion. I like to also talk about a 5th P, which is partnership, because on limited budgets like the ones we operate under, it's essential to work with partners to increase the reach of our message. As I mentioned, we used focus groups of parents to test ways to convey how much sugar is hiding in sugary drinks. We put the drink next to sugar cubes, we put it next to teaspoons of sugar, and we put it next to easily recognizable sugary treats, like donuts, cookies, and ice cream sandwiches. A number of parents said the comparison of a sugary drink to a sugary treat was powerful, especially when the numbers were so high. The soda, for example, next to 16 chocolate mini donuts. We created a series of posters that showed various sugary drinks next to stacks of treats to show parents and their kids the amount of sugar hiding in drinks. These posters were sent to hundreds of Alaska schools, public health centers, and WIC clinics. We also partnered with schools by creating a short lesson plan that was put on a DVD and mailed to schools, as well as put on our website. Our campaign staff, including myself and the Obesity Prevention Program Manager, went to 4 schools in 2 different communities to deliver the lesson plans to individual classrooms or the entire school. We showed the donut and soda PSA and also the poster, and talked about what those messages were telling us in terms of how much sugar was hiding in drinks. I also showed the children the large amount of sugar hiding in drinks by placing empty glasses next to the drinks and then filling them with teaspoons of sugar. That bottom image was surprising to kids who didn't realize that a fruit-flavored drink can have as much sugar as a bottle of soda. At the end of the lesson plan, the kids signed pledge cards to choose water or milk instead of sugary drinks. We're fortunate in Alaska to have top athletes who routinely share their time with children, promoting physical activity and choosing healthy foods and drinks. These pictures show Olympic cross-country skiers Keegan Randall and Holly Brooks, as well as Preston Pollard, a professional skateboarder who grew up in Anchorage. On the right is a picture of Allie Zergel, Yukon Quest, and Iditarod and Musher. Allie lives in Two Rivers, a small community outside Fairbanks. Last fall, I flew up there with our Obesity Prevention Program Manager. Allie joined us and brought 2 of her sled dogs and shared the sugary drink lesson plan with the entire school in her community. She talked about how water was the best choice for her and her dogs, all athletes. In social marketing, we often talk about price. How can you make a health behavior cost less? Cost doesn't always mean money. In our case, Play Everyday wanted to make it easier for Alaska children and parents to choose water. We branded a water bottle that was small enough to carry in lunch boxes and backpacks. We addressed parents' concerns about quality and made sure the bottle was BPA-free and stainless steel. We then distributed the bottles to children who completed a free physical activity challenge at their school, the Healthy Futures Challenge. About 18,500 kids completed that challenge. That's about 1 in 4 elementary-age children in Alaska. Our campaign promotes its physical activity and sugary drink messages on a website, which is playeveryday.alaska.gov. The image at the top of the website shows our soda and donut message. It's part of a rotating banner of images that highlight various messages in our campaign. In fiscal year 15, we ran 3 new TV public service announcements focused on sugary drinks, and they each had a job to do. 1, educate Alaska parents about the amount of sugar hidden in common household drinks. 2, reinforce that parents are role models when it comes to what the children are drinking. Children are watching. And 3, educate parents and kids about how to find sugar in drinks. As a whole, the 3 PSAs work together to change behaviors, to reduce the number of sugary drinks that parents serve to kids, to increase the likelihood that water and milk are the beverages served, and to increase the percentage of parents who check ingredient lists. The PSAs featured on this slide is the first in the series. It uses a concept that tested well in focus groups that we held with parents throughout the state. The PSA shows the amount of sugar hiding in a soda by putting the soda next to a stack of donuts. A 20-ounce bottle of soda can have as much sugar as 16 chocolate mini donuts. You wouldn't want your children to eat that much sugar, so why let them drink it? We're going to pop out of this presentation shortly to show you this PSA, which is on our YouTube channel, which is Play Everyday AK.
A bottle of soda can have the same amount of sugar as 16 chocolate mini donuts. You wouldn't want your children to eat that much sugar, so why let them drink it? Sugary drinks can lead to tooth decay, obesity, and diabetes. Serve water or low-fat milk. Get the facts. Visit playeveryday.alaska.gov.
My daughter looks up to me.
I'm going to come back over to our presentation shortly. Great, we can advance to the next slide. So that PSA that was just beginning, I have the YouTube address for it below. You can watch it at another time. This is our next PSA in the series, and it focuses on the idea that parents are role models in terms of what their children drink. The mother in this PSA realizes that her daughter is watching as she drinks soda and is choosing sugary drinks herself. This is putting both of them at risk for health problems. The mother makes the decision to stop buying sugary drinks for the family and to serve water and low-fat milk instead. And this is the final PSA that was run this spring, featuring a father shopping with 3 children. He talks about wanting to buy the healthiest drinks for his family, but what's sold in the stores is confusing. His children run off and bring back sugary drinks with labels that say things like all natural, vitamins, and hydrating. He shows the children how to turn the bottle around to find how much sugar is hiding in the drinks. He chooses to buy his family water and low-fat milk. When you run a campaign like this, the likely question is, how do you know it's making a difference? It's important to be able to answer that question, which is why we conducted a special 4-survey design this year to measure for change. We conducted a baseline telephone survey of 750 Alaska parents statewide prior to running any sugary drink messages to determine parents' knowledge, attitudes, and behaviors related to serving sugary drinks. Then we conducted follow-up telephone surveys of parents 3 different times this year. Each follow-up survey happened right after a sugary drink PSA ran. We were looking for things like media recall and response. Did Alaska parents see and remember the PSAs? We were looking for any changes in knowledge, attitudes, intentions, and behaviors. Did Alaska parents improve their knowledge related to sugary drinks? Did they serve fewer sugary drinks to their families? And did they serve water and low-fat milk? And finally, we wanted to look at the effectiveness of the campaign as a whole. Each TV PSA was made for a reason. It had a role to play. Did it fulfill that role? The PSAs had a positive impact on Alaska parents' intentions. They made parents want to drink healthier beverages, drink fewer sugary drinks, buy fewer sugary drinks, and serve fewer sugary drinks to children. The evaluation showed that the Play Every Day campaign was effective in educating parents of children about the large amount of sugar in drinks and also influencing intentions and behaviors related to those drinks. We saw a significant increase in knowledge about the large amount of sugar hiding in drinks after our donut and soda PSA ran this winter. This increased knowledge was maintained through the end of Survey 4, 4 months after the PSA focused on donuts had run. We also saw a statistically significant increase in the percentage of Alaska parents who reported serving their children no sugary drinks during the past week. We also saw a statistically significant increase in the percentage of Alaska parents who reported serving their children at least 2 servings of water each day. Now, I can't say that this is a cause and effect relationship between our social marketing campaign and the significant reduction in serving children sugary drinks and the significant increase in serving children water. However, these were our campaign's primary behavior change goals, and we saw these changes happen after our campaign ran. Most parents who saw Play Every Day's PSAs wanted to see more messages about ways families can be physically active, health risks linked to childhood obesity, and information about sugary drinks. In conclusion, social marketing campaigns can motivate changes that go beyond just increased awareness of a public health problem. The Play Every Day campaign showed a positive, significant change to knowledge about the large amount of sugar hiding in drinks. The Play Every Day campaign also showed a positive change to intentions and behaviors related to serving healthier drinks to Alaska families. This is the end of my talk. I want to stress again that the only way for social marketing campaigns to be successful in building awareness, increasing knowledge, and changing behaviors is for these messages to reach as many people in the target audience as possible. That's where partnerships are so important, because the audience may see the message on TV, or they may see it on a poster in their child's school, or hanging on the wall in their pediatrician's office, or on a sticker their child got at a health fair, or on the side of a water bottle their child received at an event, or on the front of a t-shirt worn by a supportive teacher, an athlete, or a community leader. I would like to continue to partner with others to help Play Every Day's messages reach as many Alaska families as possible. We are reaching them, and we are making changes. Thank you, and please let me know if you have any questions. I have a written question submitted by Susan. Thank you, Susan. Do you know how many of the schools you sent the DVD to run them in the classroom? Susan, I do not know that at this point, but we would like to continue working with teachers to get a better sense of that. Last fall, when I sent the DVD out, it went to about 200 elementary schools in Alaska. That's about half of the elementary schools in the state. But we also put it online for pretty much any school to access. So it's difficult at this point to say how many of those schools did use them in the classroom. But we're going to try again this fall. We're updating our lesson plan to coordinate with a new public service announcement we are making about how sugar adds up during the course of the day. When a child drinks a sugary drink at breakfast, lunch, snack, and dinner, that adds up cumulatively, and we want parents and families to understand that. And so we have a lesson plan in the works to coordinate with that. Another question came in, what time of day were the PSAs run? What channels? It seems that too often they run at midnight or only on public TV. That's a great question. We work with a contractor to make sure that our PSAs are run during various times of the day, and almost all of ours are run between 6 a.m. and midnight, so not between the midnight and 6 a.m. hours when people are less likely to see it. We make it a priority to run it on channels and on shows that reach Alaska parents that are of the age that they'd likely have a 5 to 12-year-old in the home. And we do run it on broadcast TV channels as well as on cable channels to get a variety of different options out there so that we're reaching parents. And this is why we do these types of surveys and evaluations, to make sure that the kind of media placement we're doing is actually effective at reaching the target audience. And we're seeing that we are reaching the audience, and that is having a significant change in terms of knowledge and behaviors. I have a question from Elaine. We're going to unmute you, Elaine, and you can ask your question. Can you hear us, Elaine?
I don't have a question.
Oh, your hand was raised, but no problem. I have another question, and how can we get some water bottles? They are so cute. Thank you, Diane. We really enjoyed making those. I have very, very few water bottles left. I would say fewer than 50. But if you want to reach out to me by email, if you have a small number that you would need, that please do. We only made an order last year that would fulfill the need for the Healthy Futures Challenge, so we don't have money left. Lisa, would it be beneficial to have the t-shirts available for sale to promote Play Every Day? We get that question a lot, Lisa, and as a state organization, I do not believe we can sell shirts. So we make these shirts available to role models, such as teachers, athletes, and other adults who are supportive of our messages, as well as to children who participate in our school assemblies and our PSA contests that we do to support the message. We don't print a lot of those t-shirts, but if there's something that you're doing that you think would work well with the t-shirts we do have, please reach out to me. Another question, did you or will you use Facebook for positive messages to parents? That's an excellent question, and yes, we do actually have a Facebook page. We started it about a year ago. The Facebook address is identical to our YouTube address. It's Play Everyday AK. Please like it, become a fan of it, share it. We have a substantial number of fans. I believe we're over 8,000 now, which is great for the first year of development. And we do routinely post to that and share posts of our partners like Healthy Futures and other organizations that promote healthy drinks and physical activity. So yes, please do become a fan of that and share it with all your partners. Again, it's Play Everyday AK. Question from Sean, would you consider expanding the campaign to families of children younger than 5 years of age, partner with the WIC program? At this point, with the budget and focus we have, most of our products will be tailored to the target audience of Alaska parents 5 to 12. However, Sean, we would love to get our materials to WIC and work with them as much as possible. We have in the past sent WIC a number of our what we call rack cards. You can find those on our website at playeveryday.alaska.gov, and then go to get the facts about sugary drinks, scroll down to a subpage called resources, and all of the PSAs that I showed, the posters, all of those materials are online for free downloading. And there's a rack card we made, which is just a 2-sided small document about how to find the added sugars by different types of names and other information about sugary drinks. And WIC was able to distribute thousands of those to their clientele for us last year. We also sent them posters, and we have the same plan to work with WIC again this year, and they're extremely supportive. So thank you for that. What kind of card? We call it a rack card. It looks like a brochure, but it only has two sides, a front and a back. And it's on glossy sheet of paper. You can go, like I said, onto our website, playeveryday.alaska.gov. There's a button at the top that says Get the Facts About Sugary Drinks. There's a drop-down menu that comes down, and the last drop-down item is called Resources. If you click on it, you'll see our posters show up. If you scroll down a little bit, you'll see the rack card that we printed for last year, and then you'll see our new rack card that we just designed a month ago that is available. I have those in printed copies. If anybody would like me to send them out, I'm happy to do that. Please email or call me. You also can download them. They'll be just printed on the paper that you have available. I have them on nice cardstock, so I'm happy to share those with anybody who would like them. What is the approximate cost of this campaign? At this point, I would say the costs are in two different categories. We support administrative costs for the Healthy Futures program, and we also support them in terms of promotion, in terms of creating public service announcements and other materials for them. The administrative support that we give them is a little bit lower than $100,000 a year. And right now, Play Every Day's public education component, which is creating the messages and using various types of media to get them out, is about $175,000 this year, which is a reduced amount than we've had in previous years. You know, if there are any other questions, I hope I haven't missed any. A number of them came in written. Are any hands raised? We have a couple more minutes if anybody else has any questions. Okay, I think that is the end of the questions. Like I said, please look at the last slide. My email address, my phone is there. I'm more than happy to give any more information about this campaign to anybody who'd like it and to share our materials. We make these materials to get them out to as many people as possible, and I have a good deal to share, so please let me know if you'd like them. Thank you so much for your time. I appreciate it.